Please give a big applause for those two from Sudirman Habibie and then Mrs. Ati Kumaladewi, Dr. Patrice Garcia Shelik, and our moderator, Mr. Khairul Mahadi.
Good afternoon, ladies and gentlemen, distinguished guests. This is an honor to me to be a moderator for this session. The objectives of our session this afternoon is to share the experiences of UCLG, United Cities and Local Government in promoting and implementing cooperation among subnational governments in Southeast Asia. But we also have two other speakers here from Gorontalo in Manila who also will share their experience in cooperating for development and explore concerns, expectations, motivations for regions to cooperate with their peer countries, cities, and local governments. Okay, first presentation, please help me welcome Ibu Ati Kumaladewi from UCLG ASPAC.
Thank you very much, Pak Khairul. Very good afternoon, honorable delegates and also all participants. It is my pleasure to be here and also to share you about what is UCLG ASPAC and what we have done in promoting partnership in line with the South-South cooperations in here. So maybe we have booth behind you, so if you really want to know more about UCLG ASPAC, you can go there and we will explain you more what is UCLG ASPAC. But in these occasions, I like to share a brief to let you know and to let you understand what we have been promoting. UCLG ASPAC, or United Cities and Local Governments Asia Pacific, is a big regional sections of UCLG that is based in Barcelona. So our headquarters is in Barcelona and we are here in Jakarta, is the Secretariat of the Asia Pacific sections. We have in total 144 members that links to 7,000 local governments in Asia Pacific through local governments associations. Our mission is to be the united voice to represent local governments and promoting its value, objective, and its interest in building their capacities and also in promoting sustainable development. Next. In doing our activities, how we transfer and how we exchange our best practices, we do it into two phases. The first phase, the preparation, is the key phase. In the first phase, we do mainly on the research and studies to identify and to assess the suitability of the best practices to be transferred into pilot cities. Because as you can see, we can see many success stories of developments, but when we do transfer and when we do replications, some components of the success stories of the best practices cannot well implemented or cannot fit to the characteristic of the pilot cities itself. So the first phase, we do mainly on the assessment. We develop indicators, how the replications can be well implemented, and also we assess the pilot cities, the characteristic, how they can adjust and they can implement the best practices itself. Also, we gain a political support from each of stakeholders, local actors, mainly on the local government itself, because this is also the key factors to ensure the sustainability of the implementation of the best practices. The second phase is mainly on the replications and also the sustainability. We transfer the concept through developing the strategic plan, and also we do many and frequent capacity building and training for local governments to help them to better understand the best practices itself. And last, of course, the monitoring and evaluation, who also play important roles to help the projects run efficiently and effectively. political will and commitment and support from all stakeholders, also the main factors to ensure the sustainability of the implementation the program itself. And we in here, UCLG ASPAC, is keen to facilitate local governments networking and cooperations among cities or among municipalities in ASEAN to help them to build their capacities in addition to prepare ASEAN Community 2015. Next. Okay, I think that's all from me. Thank you very much.
Thank you, Ibu Ati, for a brief.
I am speaking in behalf of Dr. Alvin Marcelo, who is the chairperson of AHIN. And today I will talk about the Asia eHealth Information Network, which was an organization that was formed to address health issues, especially in establishing e-health projects in countries. So, next. Okay, so the formation of the Asia eHealth Information Network was a series of stories that came together. Next. So in Hoi An in April 2011, there was an health information systems interoperability workshop. Since one of the health issues that was supposed to be addressed was the interoperability of health systems and the transfer of health data. As you know, the Philippines is an archipelago, and so many people are in separate islands. Some of them have to ride a boat just in order to see a doctor. So in emergency cases, it is very challenging. One of my colleagues, who is also a doctor, has to row a boat for 9 hours just to visit a different city from his own. Okay? So it was a challenge. The health systems in the Philippines is very scattered. Okay? So the countries agreed, The countries agreed that interoperability was important and it was elusive even within countries and within ministries. Next. Okay. So in Manila in June 2011, there was a Health Information Systems Forum, Country Ownership and Leadership. So countries used the eHealth Metrics Network framework to review their state of health information systems. So it was found through this exchange of experiences and information that patterns emerged between countries. Even though countries are in themselves different, their problems can be categorized. Okay? So Dr. Bunchai and Dr. Alvin Marcelo, not me, this is his presentation, they learned that they can learn from each other's experiences, and thus the idea for the network was born.
To address the shared problems. So that is the leadership and governance in health projects, capacity building, peer networking, and standards and interoperability. Next. So in August 2012 in Bangkok was the AHIN first general meeting, which was attended by 20 countries. They proposed a 4-point strategic plan that I mentioned before. They proposed a set of activities to address the 4 points, and the funding was received from several organizations. Okay, next. So out of these workshops, they also produced a national e-health capacity roadmap. So they have plans for implementers, for planners, and for leaders, which involved the policy, all the backing that you need, the information, and the infrastructure. Next. So in October 2013, there was an online training which was attended by 9 countries for Health Layer 7, which is a standard language for the transfer of patient records in electronic media.
And these are currently the member countries of AHIN, or rather, people from these countries are members of AHIN. Okay, next. And member sectors, we have 88 members from the academe, 167 from the government sector, 38 from international development agencies, 53 from non-government organizations, 17 from United Nations agencies, and 47 uncategorized. Next. Okay. So this is a consensus process that requires collaboration of other countries. Okay. So thank you for listening. The AHIN community was formed to address the health issues that may arise in implementing e-health projects in a country. So it involves the governance, and it's not just the establishment of the system that's an issue here. So you will see that when you have a technology that you want to introduce in a certain region, that you will have problems with the politics, you will have problems with adoption, technology adoptions. So they are here because they believe in the idea, the principle, that you cannot do this alone. So in working together, we can solve the issues effectively. Thank you.
And our next presenter is Bapak Sudirman Habibi, Kepala Bapeda Gorontalo, is the head of the planning agency of Gorontalo province. Your time is about 10 to 15 minutes.
Distinguished guests, ladies and gentlemen, thank you for the time. Actually, this time is not so good to hear the presentation because almost all a bit sleepy, I think. So, actually, I have already prepared about 65 slides actually. It is just a thing, this very comprehensive meeting. So I don't know that this 10 minutes can be seen all the presentation. So I'll try to make short, but bit protest to the committee. The time should be start from 2 o'clock actually. We produce about 800,000 to 1 million ton per year, and also grain, and also another is what is cassava and so on, but it's a bit less than 1 to 1,000. Next, please. This is plantation sector. We develop coconut, sugarcane for what is one factory in there in Gorontalo. Clove, cacao, hazelnut, and palm sugar. Next. We also have forestry sector. We produce logi, sawwood, and rattan. Next, but this potency is still raw material. We export raw material, not industry actually. Okay, macro development. This is our region. It's 5 districts and 1 cities. And our economic indicator, it is very high, 7.71% economic indicator, economic growth. And PDRB only 9.54 million. This is a first mission, Gorontalo to Sri Lanka. We visit Sri Lanka in 2002, and we discuss in some area, agriculture, business and tourism. And second mission, Sri Lanka visit to Gorontalo, 2008. We discuss about agriculture in particular, in maize cultivation. We have experience in maize cultivation. And also best practice in health sector and best practice in education. Next. This is our goals. Okay, next. And third mission, 2009, this is continue, sustain. And then fourth mission from Gorontalo to Sri Lanka. So we exchanged our visit to Gorontalo and also mission Gorontalo to Sri Lanka. Next. This is some picture of the activities, agriculture delegation. Next. This fifth mission, December 2010. is from Sri Lanka, and also 6 mission, 5 delegates from Gorontalo to Nusa Tenggara Timur to Sri Lanka. Next. This is the picture. Next. Next. Okay, next. I think that's all. Okay. Opportunity, that's a suggestion. You can find in the handout, I think you can copy it. Thank you very much for the time.
Thank you very much, Pak Sudirman. Sorry for the time constraints because we already 15 minutes behind the schedule.
My name is Annie from Malaysia. I work with various organizations from farmers to consumers and also with government in a way. My first question is to Patrick, Dr. Patrick. Now, when we talk about this e-health, my first concern as a consumer is the sharing of medical record. Are the consumers or the patient given the opportunity to give consent for the medical record to be shared? Because privacy of data is very big issue, and in developed countries this has been, and whether you work together with the ASEAN Committee on Consumer Protection, ACCP, in approaching this mechanism. I look at in terms of how they engage consumer to be energy efficient. So this is moving beyond our Vision 2020, for example. So how do we set up the planning for moving forward in sustainable development agenda? So this is my question. Thank you.
Patricia, I'm from Save the Children. We are an international independent organization for children. We've been in Indonesia since 1976, and we work very closely also with local governments at different levels in the areas that we work. Really interesting presentations from the three speakers. I have a question to Ibu Atik. Because Save the Children, we also work very closely with local government and also communities, both at the provincial and also district level. It would be really interesting for us to know of how you've been engaging with the public, especially in terms of public participation as one of your best practices. If you could share a little bit about how the process and to what levels it is being done, it would be really helpful. Thank you.
Actually, we develop some region. This concentration integrated development, like farming, integrated farming region. In this case, we try to reduce the waste. The previous time, we just burn the waste, but now we develop waste for what is energy, also the fertilizer, and also for food, for feed. This way, we still going on actually. And for sufficient energy, now it's still also going on. We develop some sources of energy, not oil energy. That is like coconut oil, and also some what is company coming to develop Jatrova.
Okay, so I will answer the question from Ms. Annie from Malaysia. First of all, thank you for that question, and that you asked that. Privacy is really a big issue, not just in e-health, but in health as a whole. And of course, we uphold privacy as an organization. I will give an example. We have several projects in the Philippines, and I'm sorry, I can only speak for the Philippines. But we have several projects in the Philippines wherein we get data from patients. And of course, the data collectors would explain the procedure to the patients. They would explain that, okay, I will enter all your patient data into this mobile phone, and this will be sent to your doctor. And then they will sign the consent. Privacy is a big issue, of course. It's still a hot topic right now in e-health, especially. especially when there are a lack of cyber crime laws in several countries. And it is also a grounds for discussions among countries in the organization. I hope that answers your question.
So thank you for all the interesting questions. I like to answer one by one. So yes, we have best practices in how to engage with households and empower them and encourage them to look beyond the economic sustainable development. We have a case of in Korea, our member, that they are willing to they develop a policy in the energy to reduce the use of energy in each of household. So they introduce and implement the policy and they provide the incentive, and here incentive is one of the key success factors that encourage household, encourage community to participate in the programs. From this dialogue, community will learn and will trust, and this is the starting point. We can engage and we can improve the public participation. I think that's all, and I hope it answers all the questions. Thank you.
Thank you very much, all the speakers today. We come to the end of this program, of this session 3, sharing the experiences and promoting and implementing cooperation among national government and subnational governments. I'd like to thank all my participants, ladies and gentlemen, and also the speakers today, Pak Sudirman Habibie, Dr. Patrick, and Ibu Ati Kamaladewi. Thank you very much for your participation. And also thank you very much for all the participants who bear with me until the end of this program. So once again, please help me give a big round of applause to our speakers. And this is the end of this session, and I return the comment to the...
Ladies and gentlemen, this afternoon, first of all, I would like to express my gratitude to the organizer for this for the invitation for me to speak on this, and I also would like to applaud the organizer, because actually this is for me, and I've already also asked around and then try some of like browsing in the internet, that this is the first time ever of a meeting that the topic is the South-South cooperation in the ASEAN framework. We do talk among each other. For instance, I'm from the Directorate for Technical Cooperation of MOFA, Indonesia. We also, I have a conversation with the TAICA, for instance, from Thailand. I also had a conversation with the MTCP from Malaysia, and also I've met with the person in charge for the technical cooperation in Singapore. But sitting together, talking about how SSTC in ASEAN, I've never done that. And so, I think we have to applaud the organizer for this. And I hope this is not the first time and last time. I hope this is the beginning of the more of conversation, online conversation, which will shape the South-South cooperation in ASEAN. Process. We get something out of this. For instance, when we are sharing experience, we also learn from their experience what has been happening in their processes. And this is also tailor-made cooperation, because this is demand-driven. We make sure that what we are providing is tailor-made. It's fit to what they need. Our partners. This is the CLM fee, and also the fee is somewhere here now. Also, we put Timor-Leste here because they are aspiring. So this is the grouping that Indonesia considered in terms of in ASEAN member countries. And this is the perspective. The main target is the main target beneficiaries. This is the priorities to receive beneficiaries, South-South triangular cooperation. These four countries. On this also as well, I failed to mention, to utilize triangular scheme with tenant partners. We have actually already examples. For instance, JICA finance some of the local governments from Timor-Leste to have a conversation with local government in Indonesia. They choose it in Surabaya and in Surabaya, to Surabaya and Bandung, ya Pak ya. And also Kepang, because Kepang is very close to Timor-Leste. So this is the scheme that we could use when we talk about inward looking. So maybe now they're some local government who are interested to have a conversation with the local government from and the ASEAN countries, and UNDP is here. So maybe at the same time we could also talk to UNDP that you are interested to have this cooperation with the local government from other ASEAN countries. And I don't have a moderator, so I moderated myself. Anyone wants to make comment on my what I presented earlier? You don't agree with that, or
maybe I just have some information about the sister city. One regional area from my province and one sister city from the other Portugal. But we learned something from the cooperation. One, we have sent the potential to discuss and to share, to learn how to share the best practice. But the problem is to communicate for the other sister have, I think, main budgeting, and then the local government not have much for the communication. And the answer is we need the provider to maybe make some form to discuss with the other country or other city to make the discuss to choose the same potential, and then we can communicate with the other country and maybe to discuss about the sister city.
You chose not quite the right partner because your sister city is in Portugal, right? It's far away. Us here in ASEAN, we have a lot of capacities that we could share with each other. I think this is the time for us to look within ourselves. And the cost of communication or transportation are not much. I mean, maybe it's